Hi, I'm Dr. Rich Bene, and I'm a surgeon here at Monarch Plastic Surgery. Today I want to talk a little bit about carpal tunnel syndrome. Carpal tunnel syndrome is a super common affliction that people have that they generally ascribe to doing repetitive work. It often goes along with repetitive work, but lots of people get carpal tunnel syndrome, and you don't have to be a repetitive worker at the factory in order to get carpal tunnel syndrome. Carpal tunnel syndrome is usually related to numbness in your hand. It can have pain as a component, but most commonly it involves numbness. The numbness pattern that people have with carpal tunnel syndrome involves their thumb, their index, their middle, and half of their ring finger. Sometimes it's hard for people to really tell what part of their hand is numb, but when they really get down to it, your little finger is usually not affected. It often wakes people up at nighttime. They wake up in the middle of the night and they can't figure out why their hand is numb, and they can hang their hand over the side of the bed or shake it out, and sometimes it will get better. Carpal tunnel syndrome is caused by problems primarily with lack of blood flow to your median nerve as it crosses an area in your wrist and base of your hand called your carpal tunnel. The carpal tunnel is made up of an area that involves bones that make up the bottom of the tunnel and a little ligament that goes across the top. The tendons that go to your fingers and this nerve called your median nerve go through the tunnel. When the tunnel is a little tight, or is more likely tight because the tendons in the tunnel got a little swollen, they could put pressure on your nerve, and that cuts off the blood flow to your nerve just enough that you get symptoms of numbness. That's why you can hang it over the side of the bed and increase the blood flow and make the symptoms go away. Oftentimes we'll treat carpal tunnel syndrome with a splint to hold your wrist in the neutral position because that makes the tunnel the largest it can be. Other times we have people take anti-inflammatories like Advil or Motrin or Aleve, and then still some other times we inject steroid into your carpal tunnel to get the swelling to go down. If all else fails, we can do surgery in which we make a little incision in the area of your carpal tunnel, and we go down to where that ligament goes across and we cut the ligament. The idea is that we give more space for the nerve when that happens. We stitch everything together and put you in a little splint for a week after the surgery, and hopefully your numbness then goes away and never comes back.